Hi, I'm State Senator Ed Hernandez, Chair of the Senate Health Committee. Let me welcome everyone to the California Pharmacists Association Exchange. First of all, let me thank each and every one of you in the audience for your participation, but more importantly, for being involved in the leadership and to make sure that the profession moves forward the way it's supposed to move forward. State Senator Ed Hernandez was born and raised in La Puente, California. Went to undergraduate school at Cal State Fullerton. I was accepted to optometry school in Indiana University, where I met my beautiful wife. Told her I love her dearly, but there was no way I was going to spend the rest of my life in cold Indiana. Came back to California and opened up my practice. And it was there in La Puente, California that I got involved in the political process, but more importantly, with the role that government played and what we can and can't do. My role as chair of the Senate Health Committee is to oversee every piece of legislation that runs through the California State Legislature dealing with health or healthcare. What we do every year at the beginning of each session, my staff and I, we have what we call a strategic planning session, where we look and determine what we're going to do and the impacts we're going to put and have on the state of California. So therefore, every piece of legislation that goes through, I will either take a position on, amend, oppose, or support based on making sure that we move forward, but more importantly, that California has access to healthcare and all Californians have access to healthcare. The problem is we have a provider gap. We are going to have a huge capacity issue, but more importantly, a workforce shortage. The problem that we have currently in the state of California is also a distribution problem. Most of the physicians in the state of California have a tendency to go into the cities where there's more income, and there's less individuals that have a tendency to go into the communities of color, and more importantly, into the rural communities. So not only are we going to have individuals that are going to be required to purchase health insurance, and we're going to have a capacity issue and a workforce shortage, we're going to need to be able to fill that void. And the way that we're going to do that is through a multi-pronged approach. Yes, we're going to have to make sure that we encourage more individuals to go in math and science, go into medical school, more importantly, become primary care providers, and return to the areas where there's the greatest need. We're also going to encourage that those individuals that go to those areas, that we try to have some type of loan repayment to get them to serve in the underserved, in the rural, and in the inner city. What we're going to have to do is be a lot smarter and make sure that we utilize the current workforce that we have much more efficiently. And that's where the pharmacists are going to come in. I have said this over and over publicly in every event that I've gone to, that pharmacists are the most underutilized and overeducated professionals, not only in the state, but in the country. This is a profession that can immediately be utilized in primary care. Right now, there's over 40,000 pharmacists in the state of California. There's a great distribution, and this is the only healthcare profession that you can actually see without making an appointment. So this is a profession that we definitely have to utilize in this system. Saying that, this is not going to be an easy venture. Anytime we have scope of practice issues in the state of California, they're always very contentious. There will be plenty of opposition, and that's organized medicine and the California Medical Association. So what I'm going to ask of you is to make sure that each and every one of you engage in the political process, because it is only you that knows your profession better than anyone else, because it's you that is going to educate the legislature on what you can and can't do safely. We're also going to be looking for allies, especially in the assembly side. And I'm very proud to say that we have an ally in Assemblymember Roger Dickinson, who will help us as we move this forward.
So is this the future of healthcare? Do you think that this is the solution?
Well, I do think it fills the provider gap between what we know will be an extraordinary shortage of physicians as we cover more people under the ACA and the services that they're going to need to be met. So this is part of the answer.
Listen, with all due respect to the gentleman from California, Is he going to give up his doctor and let his pharmacist provide this care for him? It's so easy to say this. Hey, listen, and I'm not trying to diss all of them. There are some great nurses out there. There may be some great pharmacists out there and other, the bottom line, though, is people want doctors. Wasn't this all about the best medical care? Wasn't that the argument for Obamacare in the first place? Wasn't that what it was all about?
Yeah.
Now, the bottom line is, even before this, we were going to have a shortage because of all the older people who were putting a drag on the system. The next 20 years was already going to be tough.
Yeah.
This is making it an unmitigated nightmare, and it makes you wonder what other worst-case scenarios could happen from Obamacare that we're not talking about right now.
I don't really think this is a question of compromising the quality of care. In fact, we have many healthcare professionals, such as nurse practitioners, optometrists, pharmacists, physician's assistants, who are very, very competent and capable. And what we have done historically is actually limit them legislatively in terms of the services they can provide. So I'm not concerned, in fact, about competent care being provided by expanding the scope of practice for some of these professions. The reality is we do face a shortage of physicians, at least in the short and intermediate term. We have narrowed the scope of practice in some instances without a real medical justification for doing that. And what the implementation of the ACA requires us to do is re-examine whether there are some areas in which these other healthcare professionals can competently provide quality medical care. So the point here is to make sure that we concentrate the medical resources where they're best applied and most needed. Not everything needs to be done by a doctor. Not every person needs to be seen by a doctor.
Okay.
And just as people have made adjustments to managed care and other changes in the healthcare environment, this is something that as long as we're providing quality care, people will be fine. The point here is
that will be the test.
that we can't cover people and not give them access to care.
Well, the reason why I got into politics is when I came back to California, we opened our office, I learned very, very early on the role that government played on what I could and could not do. But more importantly, what I did do is I joined my professional association, just like you guys belong to. And when I joined my professional association, it really opened my eyes to understand the need to be involved in the political process, because it was the professional association that advocates for who we are and what we do. As a matter of fact, back in the mid-'80s, I got involved in the political process through the association with our scope of practice expansion, because back then we had a very limited scope of practice. I really enjoy being a public servant. I really enjoy serving the California State Senate, but I also enjoy being a healthcare provider. And when I'm on legislative break, I have the honor and the pleasure of going back home and seeing patients. And what I really enjoy is when I go into the exam room and I start to take a history, and it never fails, someone always brings up, well, tell me, how is Governor Brown? Or what's going on in the budget? And I always tell them, I go, look, we need to talk about your health care, but it never fails. They always want to know what's going on. What's even better about being a healthcare provider is the impact that I have on the patients. There's an individual that clearly sticks in my mind. He was an elderly individual. He came in and never had an exam before, but as a matter of fact, he's never even seen a doctor before. And the only reason why he decided to come in and have his eyes examined was because he failed his DMV test. Well, during the history, we asked him some questions, and he said that he was very thirsty, he urinated a lot, and he also drank lots of water. And of course, we know that that's the first signs of diabetes. Well, we went on to do some other history, and we found out that he has a long history of diabetes in his family as well. So when we did the dilated fundus exam, we found out that he had extensive what's called diabetic retinopathy, which means extensive damage to the back of the eye. So we immediately sent him to his primary care physician, found out he had high blood sugar levels, was very close to diabetic coma. Fortunately, we were able to catch it in time, and that's how we were able to make an impact to make sure that me as a primary care provider had an immediate impact on an individual and an individual's life. Well, it's a pleasure spending time with you, and I want to ask all of you to participate in the political process and have a great weekend.